millions of people are hospitalized every year because of digestive system bleeding. If detection of bleeding and treatment are delayed, it can be fatal. That's why we will discuss how to detect the bleeding source when there's blood in the stool or when a person vomits blood. The most common cause of digestive system bleeding is due to an ulcer in the stomach or duodenum. When an ulcer erodes blood vessels, bleeding occurs. Usually it happens in the stomach near the duodenum. In this case, if bleeding is serious and significant, the person vomits blood. It is called hematemesis. If blood is partially digested by stomach acid and the person vomits it, it looks like coffee grounds, and it's a hallmark of gastrointestinal bleeding. If bleeding is weaker, there can be no blood vomiting, and the stool can be dark, tarry, and foul-smelling because digested blood is passing through the gastrointestinal tract. It is called melena, and melena is a strong indicator that bleeding is from the upper part of the digestive tract. A person with ulcer bleeding usually feels weak, dizzy, and lightheaded, especially upon standing. The heart rate is increased, called tachycardia. Shortness of breath, breathing discomfort can be present if blood loss is significant. Abdominal pain may or may not be present because the bleeding itself doesn't cause pain. If a person's skin is pale with cold and clammy extremities, a rapid and weak pulse, low blood pressure, and confusion, these are the signs of hypovolemic shock and require emergency treatment. The treatment of such bleedings is usually endoscopy. It is a diagnostic and treatment tool at the same time. In severe cases, surgery may be needed. But generally, many cases of peptic ulcer bleeding will stop on their own, although bleeding can occur anytime again and treatment is a must. The second most common cause of bleeding from the digestive system is diverticular disease. It most commonly happens in the large intestine. Sudden, painless bleeding is the hallmark of diverticular bleeding. The blood is typically bright red or maroon because it originates from the colon and is not digested compared to gastric or small intestinal bleedings. Patients may notice blood mixed with stool, coating the stool or as clots in the toilet bowl. Most cases of diverticular bleeding stop spontaneously on their own. This is also characteristic of diverticulae. The bleeding vessel clots off on its own. Colonoscopy with endoscopic hemostasis is both a diagnostic and treatment tool. If the bleeding is in an older patient, it sometimes happens due to the rupture of a small, abnormal, fragile blood vessel that usually cause slow chronic bleeding. It is called angiodysplasia. The fourth most common cause of bleeding is esophageal varices. This means abnormally dilated veins in the esophagus start to bleed. When there is bleeding from the esophagus, it can be brisk and life-threatening. This bleeding can happen due to coughing, vomiting, or direct irritation via hard or rough food, acid reflux, and progression of diseases, for example, liver disease like cirrhosis, which increases portal hypertension. This bleeding is brisk and often of large volume. The blood color is bright red because it's not digested by stomach acid. It commonly occurs at night or early in the morning. Similar to diverticular bleeding, variceal bleeding is typically painless. Unlike some other causes of GE bleeding that can be mild and stop spontaneously, variceal bleeding tends to be aggressive and requires prompt medical intervention. Endoscopic therapy is crucial and first line. Endoscopic procedures are the cornerstone of acute variceal bleeding management. Variceal band ligation is often a preferred initial endoscopic treatment.
The fifth most common cause is a Mallory-Weiss tear. This is a tear at the gastro-esophageal junction, usually due to forceful vomiting. The most common causes of Mallory-Weiss syndrome are alcohol intoxication, which causes forceful vomiting, bulimia nervosa, which is self-induced vomiting episodes, and severe vomiting during pregnancy. The sixth common cause of bleeding is colorectal polyps or cancer. Bleeding in this case is usually not severe. Sometimes it is even hidden, and the person loses blood slowly and causes anemia but no visible blood in the stool. Sometimes blood is visible depending on the amount of blood, especially after 50. If a person has blood in the stool, it requires further investigation with a colonoscopy. Usually, polyps are observed. In rare cases, cancer is also possible, especially a person with a family history of colorectal cancer undergoes earlier and more frequent screenings.
The seventh important cause is hemorrhoids. These swollen veins in the rectal area are extremely common causes of minor G bleeding. People often notice bright red blood on toilet paper or dripping into the toilet bowl. While usually not massive, hemorrhoids are still a significant source of rectal bleeding episodes in the general population. They are more common in people with chronic constipation or diarrhea. Pregnancy also increases the risk, as do obesity and prolonged sitting, especially on the toilet.